Good morning, ladies. Welcome back to the Perimenopause Manual. Dr. Alexandra Doig here, talking about breast screening. So I've literally just had my first mammogram through the Breast Screen Queensland screening program. It took under 5 minutes. I booked online and filled out a very quick questionnaire, came in today to the clinic, and it was a very simple procedure. They made me feel extremely comfortable, and yeah, it was a little bit uncomfortable when the actual mammogram was happening, but it goes so quickly and there's a huge amount of gain. So what's a screening program for breast screening in Australia? Well, essentially the guidelines have brought the age of your initial screen down from 45 to 40. So once you turn 40, regardless of your family history, you can have your first breast screen. It's all free of charge. As I said, it's just booking online, going in for your clinic visit and for your mammogram. The radiographer who did the imaging told me that my images will get sent so that they can be reviewed by 2 independent radiologists. If those 2 radiologists can't agree on findings, they will then get a 3rd radiologist to review the images. Any concerns, I will be asked back in for further investigations. Usually it starts with an ultrasound, because ultrasound will better pick up whether there's any calcification within a bit of density that you'll see on the x-ray or the mammogram, because mammogram's x-ray. If there are still concerns, someone in the clinic, so they'll bring in a doctor who will perform a biopsy in the clinic itself, again all free of charge. That biopsy will then get assessed by pathologists. If there is still uncertainty, so the biopsy is negative, but which means there's no significant findings of anything nasty, but there's still a high suspicion from the imaging that this could be something that's nasty, so a malignant breast lump, then again, all through Queensland Health or through whatever public state health system, they will then organise a wide or a local excision of the lump itself so that they can remove the entire lump and then send it to a pathologist who will assess the entire tissue for any malignant disease. All of this is completely free of charge. So there is no reason to not do this. If everything's okay today, I will get a recall message in 2 years' time to come back for another 5-minute mammogram. In the meantime, you'll continue your self-breast examination, best done in the shower because your hand can glide over your breast tissue more easily. Another really important thing to do is to lie down on your bed, hand up behind your back, and then also top to bottom, okay, do your breast self-examination. If you've got any new lumps, if you've got any discharge from your nipple, whether it's clear, serous, so yellowish color, or bloody, it's time to go and see your GP urgently to have investigations immediately, okay? But if you've got no abnormal lumps or no new lumps or just lumpy breasts and you just want to start getting serial imaging done, because that's what breast screening is, it's also a way to compare your imaging with the next lot of imaging and see if there are any changes that you may not have noticed. Then it's a time to start with your screening for your breast screening. So don't hesitate, book your appointment in as soon as you turn 40. If you start doing your screening, you don't have to think about it too much otherwise, and it's a great way just to get some baseline images of your breasts up on a database for comparison as you go into the future. Okay, so yeah, handy tip for today. We can go through some other screening procedures at another time, but really, I'm sure most of you by this age are well and truly into the routine of getting your cervical screening done. They're the two main ones for women. Hopefully in years to come, we'll be introducing ovarian cancer screening as well. But the main symptoms for that are bloating, just pelvic pain, deep pelvic pain, but bloating and like a stomach that just keeps getting bigger and bigger. Because what happens is as the ovarian tumor grows, it will actually just push the bowel contents further forward. So you end up not with so much a mass that you can feel, like a lump that you can feel, but more your abdominal contents get pushed upwards out of the pelvic cavity and forward. So you end up with what appears like bloating, like you've got an early pregnancy. Another massive symptom of ovarian cancer is that you start getting spotting again, and you get some bleeding. So that's like an immediate postmenopausal, any spotting of any sort is an immediate doctor's appointment and an immediate gynecology referral to rule out either uterine cancer or ovarian cancer. Now with uterine cancer, which is of your womb, it tends to be a bit more rare, okay, than cervical and ovarian and breast cancer. But it still happens. Predispositions to uterine cancer are predominantly when you're on hormone replacement therapy, if you're not taking progesterone at the same time. So when you take estrogen with your hormone replacement therapy, which is really the part of HRT that gives you symptom relief, it causes your lining in your uterus or your womb to grow, okay? Now, if that isn't kept in check by the progesterone that you're having, now your progesterone dosing will differ if you are within the 12 months of having some menopause changes with your period, to if you're 12 months completely period or bleeding free. The former one, you will have your progesterone just for half the month. It will be a cyclical, usually from day 14 to day 30 or day 28. When you've been period free for 12 months, you move on to just a daily progesterone. The reason that you're taking the progesterone, as I said, is just to keep that uterine lining in check, so that it doesn't grow too much and then mutate because of the accelerated growth from the estrogen and then mutate into cancer, okay? So yes, they are the 4 different types of, I guess, female cancers, and some symptoms that you need to be watching out for, as well as the screening that is currently available in Australia. You hopefully all know that by now that with your cervical screening you can do self-tests. It's still going to a GP clinic, but you can have the option of collecting the sample yourself, and they go through the guidelines of how to do that. So you still have to be in the doctor's room, but you can do it behind the curtain if you'd like to do it privately. I'm someone who I actually really appreciate the examination and the collection of the samples from the doctor, so that they can actually have a look at my cervix as well. But if you do get an abnormal finding on your cervical screening test, you are going to be referred to a gynecologist for assessment and for examination and potentially biopsies, etc. So screening is such a fantastic service that is offered by our government, and it saves lives. So don't put it off. Make sure that you keep your screening up, and make sure that you are constantly aware of any of those symptoms or changes in your body that are occurring that could be a sign that you have something nasty going on, like cancer. Okay, cool. That's it for today. I ready to go to work. I've looked after myself and now it's time for me to look after others. Okay, all the best, hey. Bye.